webinars are made possible thanks to generous donor support. If you'd like to contribute, please visit our website, autism.org.
Dr. Melissa Olive's brother, Mac, is the foundation of her mission for behavioral support. In her early teens, Missy, along with her 3 brothers, traveled with her mom and Mac to his therapies. She credits her pursuit of helping children to working with her family to help Mac. Her mother's legacy remains a strong influence because of the determination to make life better for her brother. And now I'll turn it over to Dr. Olive.
Thank you for that introduction. It is so exciting to be here. I am a big fan of ARI and all of the trainings that they offer, and so I'm honored that I get to offer something. So today we're going to talk about the ABCs of ABA. And what we're going to do is just run through some basic terminology, and then we will go through some other terms. And then we're going to also talk about some of the key ingredients of an ABA program and how you can understand what to look for when you're selecting a behavioral provider. We'll also talk briefly about the types of services that you might get, and then we'll end with a Q&A. So I first want to dispel some myths. ABA has been around for a very long time. In fact, the first issue of the Journal of ABA came out in 1967. And so we were doing research even before that. And so there are some things that that people think that just aren't so. So for starters, a lot of people think that the goal of ABA is to remove problem behavior, and that is not. Actually, our goals are multi-purpose, right? We want to increase desirable behaviors. We want to decrease undesirable behaviors. We want to see maintenance of anything that we've taught, and we want to see generalization. So we want to see those skills in every aspect of life. A lot of folks also think that ABA is bribery, and I just want to give you one example of the difference between reinforcement and bribery. Reinforcement is delivering a consequence after a behavior, and we all work, and so when we show up to work, we eventually get paid. Some of us get paid weekly, some of us get paid every 2 weeks, and I think there are still some people getting their paychecks once a month. Those are reinforcement schedules. They're not bribery, it's reinforcement. It's something that you get in return for something that you did. Bribery, on the other hand, is when you, and it's usually for sinister purposes, but it's that promise of if you do something, then you get something. ABA is only for kids with disabilities. That is another common misunderstanding. And so we know that ABA works for all types of disabilities. It works for people without disabilities, and it works across the age range. So there's no child that's too young, and there's no adult that's too old to benefit from ABA principles. There are a lot of postings out there talking about ABA being abusive. And, you know, I'm sure you've also heard that there are gynecologists that have been abusive, and that there are neonatal nurses that have been abusive, and that there are other medical or behavioral professionals who have done things that aren't okay. That does not mean that the whole lot of the therapy is abusive. And I think when you're selecting your ABA provider, you want to screen to make sure that you're not going to have any kind of potential abuse there. And of course, if you ever sense that something doesn't feel right, then you need to work with your provider to get to the bottom of it. As Denise said in the intro, I am the guardian for my sibling who's 42. And you know, we have had multiple instances of potential abuse and neglect investigations, some of which have been found to be abusive. And so again, it's about understanding what is appropriate, what is not appropriate, and selecting your provider very carefully. There's also this myth that the ABA provider makes all the decisions, and I want to make sure that you all understand, especially as parents and especially as teachers, that everyone makes the decisions together. The BCBA is likely the most knowledgeable person about behavior, but the parent is the most knowledgeable person about their child. The teachers are the most knowledgeable people about education and the education system. And so when you put those three together, making decisions together, you're going to end up with a better program. A lot of people also think ABA is a bag of tricks. And part of that is because a really good behavior analyst will come in and work with your child, and it seems like it's a bag of tricks, but it's really not. It's actually a science, and the procedures are well thought out. And as we move through some of these procedures, you will see that they are scientific and they need to be planned and implemented in order for them to be effective. We don't ever wing it. The misnomer that ABA was created by Lovaas is also not true. Lovaas was a great scientist who discovered a number of things within the field of behavior analysis. Did he do some things that cross the boundaries today? Absolutely. One of his studies, he has a group home where individuals got shocked for their maladaptive behavior, and then another group home, they received other kinds of milder punishers. We would not run that study today. Back then, before we knew what we know now, that was a common study. And so we just want to make sure that we don't throw the baby out with the bathwater. Lovaas took ABA, and he discovered that by starting early and intensively, that the long-term outcomes for those children with autism were very, very strong. The misnomer that all ABA includes shock and aversive punishers is also not true. There is a school in Massachusetts that continues to use shock for some of its students. There are many people who have moved away from punishers altogether, rarely using them, but the quick jump to aversive punishers is no longer practiced. And in fact, aversive punishers are almost never used and should only be used in really serious situations after many other attempts of reinforcement and other comprehensive behavior services have been tried. ABA cannot solve any problem, right? Some people think that ABA is the answer to it all, and it's not. And there's a lot of things that are in our scope of practice, but there are many other things that are not. And so that's why it's important, and you'll see it across all of our code of ethics, that we are to collaborate and coordinate with other providers. And then finally, a lot of people think that you can do ABA just by reading about it. And in fact, you need to read, you need to study, you need to have comprehensive training, and then you need to engage in what's called performance feedback. So practice, feedback, and then after time, you get good. BCBAs must complete a master's degree in order to become a board certified behavior analyst. It's a master's degree in 2 years of fieldwork practice. Whereas an RBT, a technician, is supervised by the BCBA. So they get an initial 40 hours of training followed by additional hands-on training and feedback. We actually call that process of training and feedback behavioral skills training. And so we model, we teach you why that's an important skill, and then we let you practice and give you feedback repeatedly. Okay, so in this little graphic, what we have are the beginnings of the ABCs of behavior. And I know it does, and I present it very simplistically, but it is quite complex. And when we're analyzing behavior, we take all the behavior, not just one episode, but the examples I'm going to give you so that you understand it when you walk away today are very simplified. So long before behavior occurs, we have these things called setting events and establishing operations, and we'll go over those definitions in a minute. Then you might have the actual antecedent that happens right before the behavior. So the antecedent is anything that happens right before a behavior that likely triggers the behavior. The B is the behavior. It's the thing that you're interested in. And we already talked about we're interested in behaviors that we want to go up as well as behaviors that we want to go down. And then finally, the perpendicular line is the consequence. It is the thing or things that happen immediately after the behavior. And sometimes there can even be a delay after that happens. So the ABCs of behavior, again, the antecedent, the behavior, and the consequence. So you can see now that the graph has shifted over slightly, so that the setting events and establishing operations are really not on the screen anymore, and you still see the antecedent, you still see the behavior, and then you see the consequence. Now, what's really important about this consequence is consequences are added or removed, right? They're either added, think about the math, or they're removed, think about the math. In adding, we usually think about the plus sign, and in taking away something, we think about the negative sign, right? Adding, removing. After the ABC happens, then something happens to the behavior. And that's one of four things, which we already talked about in the myths. Reinforcement is when the behavior increases following the ABC. Punishment is when the behavior decreases following the ABC. Then you also have, see this dashed line, that is your maintenance. So the behavior continues on at the same rate. And then generalization, which I'm not savvy enough with my graphics to get generalization onto the screen. So we have reinforcement, punishment, maintenance, and generalization. Those are the effects that we want with our behavior treatment plans. Now, there are two types of punishment and two types of reinforcement. We're only going to stay in the reinforcement paradigm today. So positive reinforcement is when that consequence is added. Negative reinforcement is when that consequence is removed. When in terms of the learner or the student, we think of the student getting their way or your child getting their way, whether it's getting something they want or getting out of something they don't want or something they don't like. Just a couple of more things about setting events and establishing operations. So setting events can be something that happens that changes the way you respond later. For example, if you don't get a lot of sleep, you might be a little grumpy the next day. And so that's an example of a setting event. An establishing operation also happens before the behavior, but it changes the value of the reinforcer. And so if I'm highly motivated by food, if I haven't eaten for a meal or 2 meals and you start to offer me something yummy, I'm going to be much more likely to engage in the behavior because that establishing operation is taking place. And Cesar, who's a big dog trainer, he talks about this often. Whenever he's on stage and he's getting ready to show off his dog's skills, he puts them into a state of deprivation so that they're much more motivated to behave and get those treats. Now, obviously, we're not going to do that with humans and make them starve in order to get their treats. But say when I'm working with children who have picky eating, they are not allowed to eat 2 hours before or 2 hours after. And that helps them see if they're hungry, they need to eat when we're learning to eat the new foods. Okay, so let's go through some of these examples and see how they apply to real life. So when we're driving the car, we see a stop sign, we stop the car, and we avoid a ticket. Seeing the stop sign is the antecedent, stopping the car is the behavior, and avoiding a ticket or avoiding a crash is the negative reinforcer. I'm avoiding something, it's not going to happen, and so in the future, I will continue to stop at the stop sign. When we go to restaurants, we sit down at the table, the waitress comes up, we order our food, and then we eventually get the food. And so the antecedent is seeing the waitress or waiter, ordering the food is the target behavior, and getting the food is the reinforcer. That example is a positive reinforcer. Sometimes we drink a little bit too much wine and we develop a headache the next day. And so when that headache happens, we take aspirin or Excedrin or Tylenol, and that headache goes away. And so our behavior of taking that aspirin is reinforced by the fact that the headache goes away. Well, that's negative reinforcement because something is removed, right? The antecedent is the headache. Taking the aspirin is the behavior that is maintained by the fact that the headache, the bad thing, goes away. Negative reinforcement. And then finally, we wake up in the morning, we drink coffee, and we start to feel good. We really know it's the caffeine, right? But waking up is the antecedent. Drinking that coffee is the behavior, and feeling good, having those sensations of being awake and alert are the consequences. Okay, so let's go through some examples of how this applies to your child or your student. In math class, the student rips up his worksheet and then he's sent to the office. In this case, the worksheet's gone and so is the math class. It could also be that there's some really nice people in the office talking to me, giving me attention, or maybe cute girls walking by, right? And so our job is to understand, why is that student ripping up that math worksheet? Is he ripping it up so he can get out of math? Is he ripping it up so the worksheet will go away? Or is he ripping it up to get down the hall to what other reinforcers are in that other room? During circle or calendar time with little kids, the student might pinch a peer, after which he's sent to timeout. This happens a lot. And while timeout is an example of punishment, timeout itself is very effective when used correctly. But for a student like this, timeout is backfiring. It's not working because we didn't understand, why is the child pinching? In this example, the student is pinching to get out of an aversive activity, which is circle time or calendar time. Another example might be during free play. The kids are playing and a peer has a preferred toy. And so the student goes over, hits the peer drops the preferred toy and goes to tattle. The kid who hit ends up with the toy. Now, he may also get a lecture. He may get, have to go to timeout or some other thing. But again, our job as behavior analysts is to go in and understand, why is that child hitting and what are those consequences that are happening when he hits. And I know a lot of times people think that it's simple and that we can just take that consequence and assume that that is the cause of the behavior, but it really takes lots and lots of observation and analysis of the data to fully understand why. At mealtime, the student will tantrum and they get out of those green beans and they get those chicken nuggets. And so again, it's very simplified, but it is often what we see in the feeding world. They're avoiding things they don't like and they're getting junk food or things that they do like. In independent seat work, the kid is calling out and calling out and calling out, and the teacher's like, raise your hand, raise your hand. Remember, I'm only going to call on people that raise their hand. That can serve as a type of attention. And then finally, the parent is on the phone and your child starts to act naughty. You have to hang up the phone and go take care of the behavior. It often results in attention. And so the child is sort of manipulating his own environment. And then you're not able to get your work done or get your phone calls completed because you have to stop. And so when a behavior analyst comes in to work on something like this, we're going to teach the student independent skills so that they can learn to work and play independently while you're doing those important things that you have to do as a parent. Okay, so we have already gone through the term of antecedent, behavior, consequent. Reinforcement is when behavior increases, and the reinforcers are the things that follow that behavior. Punishment is when the behavior decreases. It can be intentional or it can be accidental. And so same thing for reinforcement, right? We can think we're reinforcing, but in that timeout example, it backfired and we ended up reinforcing the behavior instead of punishing it. So punishers are the things that you deliver after the behavior to make the behavior go down. We really don't like to work in that area. We like to stay on the reinforcement side. And then in positive reinforcement, the student or the learner or the child gets something. In negative reinforcement, the student, the learner, the child avoids something or something is removed. So what are some of the things that we do to increase these behaviors. I'm going to go through all of these in more detail, but I first want to point out we don't fly by the seat of our pants. This is where our science comes in, and we have a plan, and that plan needs to be implemented very consistently. So one of the things that we use often are prompting procedures. Now, I just want to point out, prompting should not be in the IEP, because prompting is a teaching strategy. It is something that is implemented and then removed. And if it's in the IEP, then that means it's going to be in there all the time. So no prompting in the IEP. Prompting is an adult behavior that helps the target behavior be emitted or helps the learner engage in that behavior. We must have a plan for how we're going to fade those prompts. And those prompts come in all shapes and sizes. You might have gestural prompts. You might have physical prompts. You might have verbal prompts, right? There's lots of different kinds of prompts. And whatever prompting system you start with, it does need to be faded. I love Michael Giangreco. He does a lot of cartoons that sort of poke fun at special education and behavior analysis and other things. And this one's perfect, you know, when we talk about prompting and fading those prompts. Hey, Patty, do you want to play ball? And Patty's nodding her own head, prompting herself. And the observer, maybe it's the principal, maybe it's the para, what's that odd behavior? And the teacher, the behavior analyst says, oh, she's nodding. She's nodding yes. And those are the physical prompts that I use. The joke, Patty's teacher returned the book on ABA before he had a chance to read the chapter on fading. I hope you're all laughing at home because I can't hear you. Modeling is another technique that we use often, and it is the process of showing or seeing a behavior and then imitating it. It does require the skill of imitation in order for it to work. We can have live models, we can have video models, we can have audio models, right? When you have a book on tape and you're following along in the book, but you can also have picture models. And we know that there's a tremendous amount of research out there showing that video modeling is highly effective for students with autism. There's a point of view thing too. So are you going to film the video as if the student with autism is watching, or are you going to film the whole interaction, including both people, or whatever it is that you're working on? But we have a substantial amount of literature showing just how effective modeling, especially video modeling, is for children with autism. Shaping is another technique that we use often, and in fact, it's one of the things that we see parents use more often than anything else besides reinforcement. And in shaping, you are going to reinforce successive approximations of a terminal behavior. And a lot of times you'll see kids learn more, right? So they might start with a clap, and then over time we're shaping it up until it gets to the actual more sign. The example that parents use when students or children, when babies start to talk, they do this thing called reduplicated babbling. And so that's the ba, 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 da, 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 ma, ma, ma. And every mommy on the planet, when that baby says, mama, mama, we lose our minds, right? We have this big reinforcement party because the baby said mama. And we run around and we tell everybody the baby said mama, mommy. And so over time, we decrease that party, right? We decrease the reinforcement and the reaction when the baby goes, mama, 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 and we gradually shape that baby up to say mama or mommy. And that gets reinforced. And over time, every time the baby says mommy, we're like, what, honey? And then over time, we actually don't want to hear it anymore because it's mommy, 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 mommy. And then we just go, will you shut up? But shaping, again, used often. And the same thing would apply to, say, when a baby learns to walk. We have those cheer parties, and then we fade off that reinforcement. Which, of course, when I was talking about reinforcement, it's probably the most important part of an ABA program, but those reinforcers must also be faded. And you have to have that reinforcement fading scheduled and planned and well thought out. But we all operate off of reinforcement, so you can't get it down to zero. Okay, in chaining, we it's actually two instructional things that are happening. In chaining, we first create this thing called a task analysis. You might hear behavior analysts call it a TA. And in that TA, we make a step-by-step of everything that would be needed in that task. Some typical task analysis things are putting on your coat, brushing your teeth, making a bowl of popcorn. Those are all things that require multiple steps. And so we take it, we break it down, and then we teach those steps. And there is a way to teach. Again, this has all been proven with research. You can do forward chaining, backward chaining, or total task presentation. In forward chaining, we start with the very first step, right? And this is typically what we do with toothbrushing. So we maybe have a task analysis with pictures, and we show the student, okay, we're going to start brushing our teeth. What do you need to do? And they will start by grabbing that toothbrush, right? And you may or may not reinforce that step, but the next thing they need to do is get that toothpaste. And so you may have to prompt that step, and you may have to prompt all the remaining steps until their breath is all clean. In backwards chaining, we don't teach until the very end so that the student gets that association with, I did the final step and now I get reinforcement. And I love to do toilet wiping after a BM using backwards chaining because it helps ensure that the hands don't get dirty. And separately, I'm going to teach the act of wiping using non-poop substances. But nonetheless, we go through the toileting routine, learner has the BM, and the wiping is done for them so their hands stay clean. And then on the very last wipe, once everything is clean, then the learner does that step of wiping. Oh, the tissue's clean, throw it away. And then we pull up those pants and wash our hands. And so they get, in the early stages when they're learning, we do give a big reinforcer when they finish that whole chain. And then in total task presentation, we teach it all at once. And, the learner's learning all the steps all along the way. Now, shifting out of the techniques that we use to teach the targets, I do want to spend just a little bit of time on how do you select the target. We already talked about in the myths that the targets are selected together. And so that means the behavior analyst and the parent, or along with the teacher, are selecting and identifying things that are super important. We also base all of our work on an assessment. And so at least one assessment, if not multiple assessments, should be done to help identify what skills does the student have, what skills do they need to learn, and in terms of a developmental progression, what skills have to come first before we teach that last skill. And a lot of parents are like, I want my kid to talk. Well, yes, we all want them to talk because individuals who are nonverbal are at much greater risk for abuse. And so we want them to learn how to talk, but you can't learn to talk if you don't develop those prerequisite skills. And so gross motor imitation comes first, followed by fine motor imitation, followed by oral motor imitation, and then into talking. And so you will often see in ABA programs, they might start with the teacher says, do this, and they stomp their feet, and they work on the student stomping their feet. And that is a prerequisite to spoken language. I know that doesn't seem logical, but it really is. We also make sure that we're working on age-appropriate skills. Just because we can teach something doesn't mean we should. And so we think about a 2-year-old, the 2-year-old might be able to recite numbers or letters or even do some sight reading, but that might not be the right thing, especially if that 2-year-old can't wash their hands or can't pull up their pants or can't find their shoes. We also focus on things that are immediately useful. So we don't want to be teaching preschoolers college skills because they won't need them for a long time. But we do want to teach preschoolers skills that they're going to need to function at home and to function in their preschool environment. We also make sure that all of our targets lead to independence, focus on independence, and are socially significant. So we don't want to teach something that other people don't think are valuable. And sometimes we can, again, get down that path of focusing on things that just don't matter. And then, of course, by working with the family, we are making sure that what we're teaching is culturally appropriate for the family and the student. So this is an example of a goal that was written that did not think about the environment and the context. And so we always want to think about, where is the student or the child going to be doing the behavior? And so what are the things that we need to think about when we're targeting that behavior? And so in this example, again, Greco really kind of makes fun of us forgetting the need to teach the details, right? Which is making sure you don't walk or fall into a manhole. The next one is my all-time favorite. I show it in every ABA course that I give, and that is that Mrs. Walker learns the hard way that sometimes AD correct just isn't good enough. And you often see in IEPs, you know, targets of 70% or, God forbid, 50%. You don't want chance. You want the student to do the behavior when they're supposed to do the behavior. But sometimes it does need to be 100%. Toileting is an example of a skill that we want at 100% accuracy. Now, I'm going to make a shift and talk a little bit about how do we go about decreasing behaviors. And you know, there's some key principles here. First and foremost, reinforcement should always be done first. Our Code of Ethics for Behavior Analysts says that reinforcement should always be done first. We also know that we cannot start a behavior plan until we have done an assessment. It is a slightly different assessment than the assessment that we do for skill acquisition or learning behaviors. It is called an FBA, and I'm going to describe that in a second. And then from the assessment, we develop a treatment plan, and it needs to be a simple treatment plan that everybody can implement. Now, in the FBA, and I don't really have time to go into great detail about this, but if this is a topic that you guys want to learn more about, be sure to let Denise know, and I'd be happy to come back and do another talk for ARI on what to look for in a quality FBA. But FBAs happen both at school and in ABA programs. So they are a common practice, a required practice, anytime you're going to build a behavior plan. So the first thing that happens is an indirect assessment, right? We go in, we interview the student, we interview the parent, we do rating scales and other things, and that's a necessary step to help us get a good picture of the behavior. We call it indirect because we're not talking to the student. When we get to the direct observations, which are here, those are the things that we do next, right? We are observing the student, and oftentimes we need your help. We need parents and teachers to help us collect those ABC data, writing down what happens before the behavior, what was the behavior, what happened after the behavior, so that we can analyze those data and really get a grip on why is Johnny being naughty. And then there's a third thing that can be done in some instances, and that's called a functional analysis. It's not required. There are some controversies over doing it in school classrooms because it does evoke behavior. And we really don't want to set kids off at school because it could cause harm to them and to their peers, not to mention stigma. We also know that there are other analyses that are being done in the literature called practical functional assessment and ISCA analyses. And so those are certainly other options should you not have enough information during your observations. After you have all of your data analysis done, then you develop a hypothesis, and it comes back down to that positive and negative reinforcement. Why is the behavior happening? Because the learner's getting something, or because the learner's getting out of something? And sensory does fall in there. We haven't really talked about sensory behaviors, but sensory behaviors can be automatically maintained. So they're not necessarily getting something from somebody or getting away from something from somebody, but rather getting those internal sensations. And then finally, you ask that question, am I able to do this treatment plan based on what the child wants? And the perfect example here is, you know, my brother has multiple seizures, and so he has to take multiple medications to keep them under control. And we know that if he doesn't take those meds, he will have a seizure, hands down. No, it's not even open for debate. And if Mac were to engage in problem behavior around taking his medicine, we would not be able to honor his request. We could let him take his medicine with something else, like, oh, so you want to take your medicine with soda? We can do that, but we can't skip taking medicine. All right, so some of the terms that you need to be familiar with is reinforcement. And again, we're going to pack a plan with reinforcement, and we're going to plan how to fade it. Reinforcement can come in different forms. So you've got differential reinforcement, and you also have non-contingent reinforcement, both of which are highly effective at behavior production. You might have the term behavior intervention plan or behavior support plan, so a BIP or a BSP. And then positive behavior interventions and supports. We're going to talk more in depth on that. And then we have our replacement behaviors, which you always want to make sure that the problem behavior is replaced with appropriate behavior. And that's most often done through functional communication, or FCT. Another great intervention that you might see in a BIP would be high probability request. So some take-home points here. The BIP is designed for the adults. It is not you might call it the child's BIP, but it's really an instructional process for the adults to follow. The IEP, or the treatment plan, is the instructional process for the learner or the student or the child, right? So the BIP is for the adults, and the IEP is for the student. So what is PBIS? And I'm just going to throw all these bullets out here so we can see them all and walk through them. So PBIS is actually based on ABA. It is the science of human behavior. So it came right out of ABA. And it really shifted from this punishment aversive approach over to a more positive approach. And so our interventions are simple. We want to have these nice, simple interventions that everybody can implement with fidelity. They're always based on assessment, so that FBA has to be done before we can design a treatment plan. They always teach communication, right? Because I said, you got to have those replacement behaviors. And oftentimes kids do bad things because they can't or don't know how to communicate the right way. And so we're going to teach those replacement communicative behaviors to make those behaviors go down. We always focus on independence. We've already talked about that once today. And so we want to just continue making sure the BIP moves that student to a state of independence. We take data. We have to know if the intervention's working. And again, because we're building that BIP with the family and with the teacher, our cultural and social values are a part of it. And finally, we need to see behavior change across all environments. It is not okay to say Johnny's fine at school and not address those behaviors at home. It's not okay to say we don't see that in the center and the student is still doing it at home. So we want to make sure we address those in every setting. PBIS is not the same plan for all children. It is a simple form. It is not a simple form that's created in a meeting, and it's not filed away and never seen again. It's got to be implemented. So it needs to be simple. It should not look like anybody else's plan, and it needs to be open and actively used so everybody knows how to do it. The last thing I'm going to say is that the plan should never include restraint and seclusion. In most states, it's actually a violation of the law. Okay, when a student doesn't know how to drive, what do? We teach. When a child doesn't know how to wash her hands, what do? We teach. When a person doesn't know how to read, what do? We teach. But in our country, when a student doesn't know how to behave, everyone wants to resort to punishment. And so we just want to shake up that belief system and move everybody over to a positive approach and thinking about reinforcement first. If you don't know where you're going, how do you know if you ever get there? You definitely need to have your data. And so the data terms that you should hear in a good ABA program, you're going to hear frequency, duration, latency, interval data, rate data, percent correct, task analysis, graphing. In some of the fluency literature, you're even going to hear that term fluency, helping the student do something faster and correctly. And you know, I love my graphs. What are you doing with our student data? Oh, when I started, it was raw data. It's still not done. Student data is extremely valued, but not if it's half-baked. And by this, Gian Greco means Data on paper don't do anything. Those data have to be graphed, and then we have to look at those graphs and make changes to our treatment program frequently. Which leads us to, how do I know if my treatment or my ABA provider is good? And I think the most important thing is that you interview anybody that you're going to start to work with. They owe it to you to talk about their program and to talk about what to expect from their program. And so for starters, you need to have BCBA oversight of any behavioral program. And that in some states, it's actually going to be a licensed behavior analyst or some other term that's similar to a licensed behavior analyst. But that oversight needs to happen about an hour for every 10 hours of therapy. In some instances, it may even be 2 hours for every 10 hours of therapy. And that's about a 20% ratio. For most severe cases, it could go up to 3 hours or more if it's a real severe case. Like feeding, for example, is tough in the early days. And so we come in and we provide much more supervision and oversight early on, and then we fade out. Our feeding program is 5 days. And so just a couple of days of intensity of that BCBA and then transitioning out. The procedures must be implemented by a trained provider. I alluded earlier to the fact that BCBAs have master's degrees and 2 years of experience that are supervised. Well, the technicians should also have comprehensive training, a minimum of 40 hours, followed by hands-on, that behavioral skills training, right? Hands-on training and feedback, training and feedback. We know that every quality program is going to have ongoing data collection, graphing, and using those graphs to make decisions. And when the child is not making progress, you have to change something. You cannot keep going making no progress. That's a violation of our code of ethics. We want family involvement all the time. We also have to be considerate if the parents are working, and so the services need to fit your schedule. So if you need to do your parent training after work or during your lunch break, then that's what you'll have to do. But we have to have you involved so that we get the maintenance and generalization of the skills that we're teaching. And I've already said this, but we have to coordinate our services with others and collaborate in that process, because if everybody's working with the learner, we want to make sure that we're all moving in a forward progression. Okay, so your ABA could be in a center, it could be at home, it could be at school. You could have a comprehensive program where you're working on all areas of development. You could also have a focused program where you're just working on one thing. And when I'm doing feeding, I'm doing a focused feeding program. I have, however, done a comprehensive program where we did feeding, toileting, and sleep all in 5 days. You might also have school consultation where an ABA provider consults to the school district. And so in those situations, you want to make sure that it's documented well in the IEP, that you get the data, that you get session notes, that you have a really good understanding of exactly how much consultation is happening and how and when. And I think the other thing that will be great is referring to the ASD guidelines that were originally developed by the BACB, which is the certification board. And then they passed them on to CASP, which is the Council of Autism Service Providers. And so that's where the document is housed. We're up to version 2. Version 3 is going to be coming out probably in early January. And so again, always keeping up with what everybody recommends in the field, so that you, when you're interviewing those providers, you know that you're getting that quality that you expect. And that timer means that I'm out of time. And Denise, I'm going to pass it back to you for questions.
Okay. One of the questions we got was about eating, and you talked a little bit about adaptive skills. So do these positive behavioral approaches work for helping individuals who have sensory issues or who are having different struggles with eating?
So, like I said, ABA can work on a lot of different behaviors. And when you're talking about sensory or when you're talking about eating, then you want to make sure that you understand the why. And so we know that sensory problems are, they're tough for kids for different reasons. Sometimes it's about that they're taking in too much sensory, or they're too sensitive to the sensory. And other times it's because there might be a biological problem causing it. And so I think what's really important is the behavior analyst would work with someone who has sensory specialties, right? That's not our training. Our training is behavior. And so if they have a sensory overload, maybe they cover their ears, right? Or plug their ears. The plugging the ears is the behavior that we can help, but not until we understand why are they plugging their ears, if that makes sense. Feeding, on the other hand, there can be all kinds of things that cause the feeding problems. That could be food allergies. That could be a mouth development problem. That could be an underlying medical condition that keeps them from being able to eat. And so a behavior analyst might want to work on feeding, but they really shouldn't do so until we have that full picture of why.
Okay. So the next question is about how long. So I think I know the answer to this, but when you set a goal or identify a behavior to help support, how long should it take? How does that work? How do you measure whether it's been too long and it's time to change the approach?
So I'm going to come back to quality. And so if your child is not learning, something needs to change. And so I would first start with changing the program, which could be changing the reinforcer, it could be changing the prompting, it could be even changing the staff, right? Because sometimes staff don't always click with the student. After a couple of changes with the program, if you're still not seeing positive outcomes, then you really need to go back and reflect on is maybe this particular company is not working. Maybe I need to change ABA providers, but ABA works if it's done properly. And so this could be about a training issue, right? Has the technician not been trained enough? Is the supervisor not there enough? So always go back to that quality because the child should be able to make progress. But I also really urge you to continue learning through the ARI webinars. I learned so much during all of my time with ARI and the trainings that they provide. And by that, I mean, I have learned that there are medical conditions that affect the autism even further. And so if the medical condition can't get fixed, then it's going to be very difficult to learn. So if I've got stomach aches, I'm not going to be interested in learning about math or social skills or anything else for that matter. And so if a program is not making progress, it might also be to the fact that you're not treating the whole child. And so I think that's super important.
Okay, the next question is about ABA or positive behavioral strategies for ADHD or just for general impulsivity. So maybe a child who doesn't have autism, but who has these other challenges. Is it the same approach?
Yeah, so we know that the American Pediatric Association has recommended that young children always get behavioral intervention before medication is attempted. And so again, it's about understanding the behavior and the why. And it's not uncommon for children to be more hyper when they're consuming more sugar or processed foods. And so that might be the first fix, right? Is looking at, are there some dietary things that we can change that will minimize some of those behaviors? We can also teach attending. We can teach children to sustain their attention longer and longer and longer. And so that's another approach that could be used. And then teaching children to learn to tune out distractors. And I apologize, I read that there were some people that were distracted by the background. I was also distracted by the background. It was making me insane. So I apologize about that. But that is one of the things that we help learners do, is learn how to tune out background things so they can focus. But it may even be that you have to do some environmental arrangements, in that maybe the student needs some barriers when they're doing very focused work so that they can have that help in tuning out. So yes, ABA can be used to help kids with impulsivity and some hyperactivity, but it comes back to treating the whole child and understanding the why are those behaviors happening.
So the theories are the same, regardless of what the official diagnosis would be. The strategy
Correct.
using positive reinforcement and encouragement would work for different disorders.
Absolutely.
Okay. I've had lots of questions about the handouts. We had the link in the reminder email today, and then I've also posted it in the Q&A. So if people are looking for those handouts, they are out there. And thanks, Missy, for providing those. This question is about seclusion. So if seclusion is not a good reinforcer, how do you respond to aggressive behavior in a classroom, especially when this makes other students feel unsafe? So obviously you can't address this particular student, but generally speaking, how do behaviorists address that?
Oh, absolutely. It's a fantastic question. So, especially in the school safety climate that we're operating in today, teachers need to feel safe, students need to feel safe. Your child has the right to education with their peers. And so there are things that you can do early on to make it be successful while gradually building up the students' ability to go back into the classroom. So seclusion, by definition, is alone. You're put into a room with no one, including the teacher. You can do one-on-one instruction in a private room, and then most people will stay safe. I'll give you an example of a learner that we worked with back in Connecticut. He was having a very difficult time in the group classroom, and he was hurting other children. He was hurting the teacher, and the teacher wanted him out of her classroom. You cannot blame her for that. And so we found a room in the school that we could use to do some individual instruction. And so the learner would go to the classroom, say hi to everybody, and then say, hey, I'm going to go hang out with Miss Missy. I'm just using my name because I don't want to reveal who it is. And so then I would take the student to this one-on-one room, and we would work in private. And then when the student was ready, we would go back for a very short period of time in the classroom, and then again make that transition back, teaching the student to say, I'm overwhelmed, right? This is loud. This is too hard for me. I can't do this hard work. And learning to ask for a break instead of beating everybody up or hurting people in order to get the same break. And we had a hard time bringing the principal up to speed on this. I'll be honest with you. The principal wanted to go straight to punishment and send the kid home. And there's another layer in that the kid actually did like going home, because guess what? When they go home, they get their iPad, they get their computer, and there's no work to be done. And so it was working together with the team that we put in this plan where we did baby steps. We were shaping the behavior up, and we were teaching the student to tolerate regular classroom instruction. But it required everybody to be on board and everybody willing to go at the student's pace instead of taking a square peg and trying to force it into a round hole.
All right. So more questions here. This question is about environmental distractors, and you were just talking about distractions. But sometimes, I mean, as a parent, I've experienced this for certain, that sometimes in the end, I just end up getting rid of the distraction so it's just not a factor anymore. But if it's something like a ceiling fan or something like that just can't be removed from the room, what are some strategies that therapists use to get that condition so it's not so distracting?
Also a really good question. So just yesterday, I went to see another little girl, and oh my gosh, she was so cute. But she has a lot of visual stimulation or self-stimulation that she does with her vision. And so she will line herself up with glass doors. And so she was supposed to be working and learning. And instead, she was kind of looking at the flickering object. And so she was working with one therapist, and because I was an observer, I walked over and kind of stood between her and the door, but without getting close, right? Just enough so that she couldn't see the light. And so there are simple things that you can do that don't have to be aversive. And I think, again, it just comes down to putting multiple brains together to figure out how to make that work. And maybe, for certain periods of the day, we turn the fan off so that the fan is not the distractor. Every time I take my brother to a medical appointment, we have a little routine that we do, and he climbs up on the bed and he takes his shoes off, and if possible, I get like a blanket or something to put over him. But if there's a window in the treatment room, he likes to have the shade pulled, which could be a HIPAA issue, right? But it's also a preference issue. So I raise the shade for him. So again, it's about looking at the learner, the student, and the environment, and figuring out what modifications can and can't be done. And then when you can't modify something, can we gradually teach the student to learn to tolerate it?
So this is a question about how much do ABA therapists take into account setting events when they're conducting an FBA?
They should take that into serious account. It should be documented in the ABC data collection that they're doing when they're observing. And if they're asking the parent or the teachers to help out with those ABC data, they're going to train them like, this is how you remember the antecedents. And, as you get older, like I am, you begin to realize your memory is not as good as it used to be. And so it's super helpful to write those things down as they occur. And sometimes when I'm back reflecting, like, I had my brother at the doctor last week, and he was very agitated and was attacking me, and I went back to try to figure out if there was something else that was maybe triggering that. And I will tell you, we had a very, very, very long wait, and he's not good with waiting. And so that was a setting event to some of his behaviors. Was it the cause? I don't know. I can't say that was the thing that made him attack me, but it definitely was a setting event and should always be considered.
Okay, this person says, I've always felt that ABC is too simplified an approach for the kind of actions that kids on the spectrum exhibit. There's a lot of assumption or observer bias when you characterize behaviors this way. I'm not sure calling out behaviors are always maintained because kids get teachers' attention in the form of reminders. So do you have thoughts about that?
Absolutely. So when you sneeze, are you sneezing because someone says, bless you? And when you write an ABC chain down, that's going to be the most frequent consequence of a sneeze is someone says, bless you. And so we know that we don't sneeze to get the bless you. We know that we sneeze because there's something itching our nose. And so again, I simplified it because we only had an hour to talk about it. It's about looking at all of the antecedents together as a package to better understand. And if we can ask the student themselves and they can tell us, even better. But some of our students don't talk, and they're not able to tell us why they hit somebody or why they're biting. And so again, I simplified it for this presentation, but it is a much more complex process when you're gathering the data and analyzing the data.
All right, I know you're out of time. I'm going to squeeze in one last question. This is relevant to the year we've all just been through, the last year and a half. So during the pandemic, a lot of people have had to use online therapy. That's been inevitable for a lot of families. And I'm wondering if, because of that, if anything was learned about how effective or ineffective that is for doing behavioral intervention.
Oh my God, what a great question. And I'm glad we're going to squeeze it in. So for starters, my own child does therapy, and she wanted no part of online therapy. Partly because I think she was worried that we would hear her talking to her therapist. And so for her, that didn't work. But we actually have a whole lot of research coming out because people were doing research during the pandemic, trying to figure out about telehealth and if it was effective. And what we learned is that for some kids, they actually did better in telehealth method. And so we have to figure out why. So remember when I was talking about modeling and video modeling and how effective video modeling is? It can be even better than live modeling. And so that's the part of autism and their unique learning traits that we don't fully have a grasp on. And I don't know if it has to do with that two-dimensional, like there's not any other distractors, I'm just watching the video, or what, but we do know some kids did way better in telehealth.